Welcome to Roadmap to Residency Evidence-Based Applications. In this video, we will be discussing some questions about the different lab techniques and its pathological integrations. So here we have, which of the following molecular technique is the most suitable for amplifying and detecting the DNA of the suspected pathogen in the sputum sample? So a 45-year-old woman presents to a primary care physician with complaints of persistent cough, fever, and fatigue for the past week. She reports a recent history of travel to a tropical region. Physical examination reveals decreased breath sounds and dumbness to percussion over the right lower lung field. A chest X-ray shows consolidation in the right lower lobe consistent with pneumonia. A sputum sample is collected for microbiological analysis. Given the patient's travel history and clinical presentation, the physician suspects infection with a specific bacterial pathogen. Now, which of these following molecular techniques is most suitable for amplifying and detecting the DNA of the suspected pathogen in the sputum sample? Immunohistochemistry, ELISA, polymerase chain reaction, Western blotting, or fluorescence in situ hybridization? So the correct answer is C, that is polymerase chain reaction. So in this clinical scenario, the patient presents with symptoms suggestive of pneumonia following recent travel to a tropical region, indicating the possibility of an infectious etiology. To identify the specific bacterial pathogen causing the pneumonia, molecular techniques can be employed to amplify and detect the pathogen's DNA in the sputum sample. PCR is the most suitable molecular techniques for this purpose. PCR allows for the amplification of a specific DNA sequences, enabling the detection of even a small amount of pathogens DNA present in the clinical sample. Now, by targeting the conserved regions of the pathogen's genome, PCR facilitates the rapid and sensitive identification of the causative agent, aiding in appropriate treatment selection and patient management. We also talked about some other options. So option number A, that is immunohistochemistry, is a technique which is used to visualize specific proteins in tissue sections using antibodies labeled with a chromogenic or fluorescent tag. While IHC is valuable for protein detection, it is not suitable for amplifying nucleic acids like PCR. ELISA is an immunoassay technique used to detect the presence of specific antigens or antibodies in samples. ELISA is not designed for nucleic acid amplification and is primarily used for protein detection. Western blotting is a technique used to detect specific proteins in a sample based on their size and charge. Western blotting is not suitable for amplifying nucleic acids like PCR. Fluorescence in situ hybridization is a molecular cytogenetic technique used to detect and localize specific DNA sequences within cells or tissues sections using fluorescently labeled DNA probes. Now, while FISH is useful for visualizing nucleic acid sequences, it does not involve nucleic acid amplifications like PCR. Now, here we have one more question with us. Which of the following parameter can be assessed using flow cytometry in this patient? So, a 32-year-old woman presents to a hematologist with complaints of fatigue, easy bruising, and frequent infections over the past few months. Physical examination reveals pallor and petechiae on the skin. Lab investigations show pancytopenia with decreased red blood cells, white blood cell, and platelets. A bone marrow biopsy is performed, which reveals hypocellular marrow with increased fat cells and decreased hematopoietic cells. Flow cytometry analysis of bone marrow aspirate is ordered to further evaluate this patient's hematological disorder. Which of the following parameters can be assessed using this flow cytometry in this patient? Erythrocyte sedimentation rate, hemoglobin concentration, cell surface antigens and markers, coagulation factor levels, or serum protein electrophoresis. So, cell surface antigen and marker. Flow cytometry is a powerful technique used to analyze and quantify characteristics of individual cells in a heterogeneous population. It is commonly employed in the diagnosis and monitoring of various hematological disorders, including leukemia, lymphoma, and immunodeficiencies. Now, in this clinical scenario, the patient presents with pancytopenia, and flow cytometry analysis of bone marrow aspirate is indicated to further evaluate the underlying hematological disorder. The flow cytometry allows for the assessment of cell surface antigens and markers expressed by hematopoietic cells, providing valuable information about their phenotype and lineage. By labeling cells with fluorescently labeled antibodies targeting specific antigens, flow cytometry can identify and quantify different cell populations, including hematopoietic stem cells, progenitor cells, and mature blood cells. Abnormal expression patterns or alterations in cell surface antigens can aid in the diagnosis and classification of hematological malignancies as well as monitor response to the therapy. Now these are about the other wrong options. So again, we have one more question with us. A 50-year-old woman undergoes a routine mammogram which reveals a suspicious mass in her left breast. A subsequent biopsy of the breast mass confirms the presence of invasive ductal carcinoma. The oncologist orders immunohistochemistry chemistry analysis of the tumor tissue to further characterize the tumor. Which of the following parameters can be evaluated using immunohistochemistry in this patient's breast tumors tissue? Tumor size and extent of invasion, presence of estrogen receptor and progesterone receptor expression, mutational status of the tumor suppression gene TP53, level of serum tumor markers, and degree of tumor vascularization. So presence of estrogen receptor and progesterone receptor expression, immunohistochemistry is a widely used lab technique that utilizes antibodies labeled with chromogenic or fluorescent tags to visualize specific proteins in tissue sections. In the context of cancer diagnosis and characterization, IHC plays a crucial role in evaluating the expression of various biomarkers within tumor tissues. Now, in this clinical scenario, the patient has been diagnosed with invasive ductal carcinoma of the breast. An IHC analysis of the tumor tissue is ordered to further characterize the tumor. One of the key parameters that can be evaluated using IHC in breast cancer is the expression of hormone receptors, specifically estrogen and progesterone receptor. Now, these ER and PR receptors are very, very important to aid in the treatment of the patient. Or you can say that the treatment is directed based on the expression of the ER and PR receptors. Let's do one more question. So which of the following is the most important method for examining the cytology specimens to aid in the diagnosis of the lung mass? 55-year-old man presents to his primary care physician with a persistent cough and hemoptysis. Chest X-ray reveals a suspicious mass in the right lung. Bronchoscopy is performed and cytological specimens are obtained from the mass for further analysis. Which of the following is the most appropriate method for examining the cytology specimens to aid in the diagnosis of the lung mass? Immunohistochemistry, ELISA, flow cytometry, thin prep cytology, fluorescence in situ hybridization. So thin prep cytology or liquid-based cytology. In this clinical scenario, the patient presents with symptoms suggestive of a lung mass and bronchoscopy is performed to obtain cytology specimens from the mass or for further analysis. Cytology involves the examination of cells obtained from various body fluids or tissues to aid in the diagnosis of neoplastic and non-neoplastic condition. Thin prep cytology is the most appropriate method for examining the cytology specimens obtained from the lung mass. Thin prep cytology involves the collection of cells in a liquid medium, which is then processed to create a thin monolayer side for microscopic examination. Now, these are about the different other wrong options. Now, in this video, I only wanted to highlight the important lab techniques used in the pathological part. And these are the very important questions which may show up in your examinations if they want to ask about different concepts, because these are very basic concepts and you need to be clear about these concepts. For further, you can refer to the first aid part in the biochemistry chapter where they have detailed discussion about the lab techniques. Thank you for watching. Keep studying hard.